the first trimester. Those magical 12 weeks where your body starts growing a human. And in return, you get nausea, mood swings, and an unexplainable hatred for your partner's chewing sounds. Whether you're crying over spilled milk or Googling, "Can you survive on crackers alone?" You're not alone. Today, we're diving into the weird, wonderful, and slightly nauseating world of first trimester pregnancy, featuring real moms' experiences and slightly ridiculous stories. Let's get into it. Welcome. In today's video, we'll explore the first trimester, from fertilization to the end of week 12. This is the embryo to fetus period, where organogenesis occurs, meaning virtually all major organs are formed during this critical window. That makes understanding this stage essential, both emotionally and medically. Let's listen in. Week-by-week clinical development. Week 1 to 2. Germinal and early embryonic stages. You're technically not pregnant yet. These are the weeks of your last menstrual period. Ovulation and conception typically happen at the end of week 2. Week 3. Fertilization happens. A sperm meets the egg and forms a zygote. Week 4. The blastocyst implants into the uterus. This is usually when you might get a positive pregnancy test. You may start to feel early signs like fatigue or sore breasts. The embryo resembles a tadpole. The neural tube, future brain and spinal cord, early heart, eyes, ears, and limb buds begin forming. These structures are extremely sensitive to environmental exposures like alcohol, certain medications, or infections. Week 5. The embryo is now the size of a sesame seed. The heart begins to form and might even start beating. This is called the embryonic stage, where stem cells differentiate into hundreds of cell types, the placenta and amniotic sac develop, and the S-shaped heart tube begins beating. Limb buds, facial features, organs, and the placenta all grow rapidly. By the end of week 8, all major organ systems are present. Week 6. Heartbeat becomes detectable via ultrasound. Morning sickness may kick in. Week 7. Arms and legs are starting to form. Baby's brain is growing rapidly. Week 8. Facial features begin to develop. The eyelids, nose, and lips. Week 9. Your baby is no longer an embryo, now called a fetus. Major organs are in place. Systems mature, reflexes develop, tiny tooth buds, taste buds, and spinal structures appear. And by week 12, the fetus measures around 3 to 4 inches and weighs about 0.5 to 1 ounce. Week 10. Fingernails form, and baby is about the size of a prune. You might notice a baby bump soon. Week 11. Baby starts to move, although you won't feel it just yet. Week 12. Baby's reflexes are developing. This marks the end of the first trimester. Risk of miscarriage drops significantly. Common first trimester symptoms. Nausea and vomiting, morning sickness. Affects 50 to 80% of pregnant individuals. Thought to result from elevated HCG and estrogen, slower GI motility, low blood sugar, and changes in metabolism. Morning sickness peak and red flags. It typically begins around weeks 5 to 6, peaks near week 9, and should resolve by 16 to 20 weeks. Onset of vomiting after week 10, or presence of pain, fever, or dizziness, warrants medical evaluation. First trimester. Specific conditions. Hyperemesis gravidarum (HG). HG represents severe, persistent vomiting leading to dehydration, ketonuria, and greater than 5% pre-pregnancy weight loss. It can result in metabolic imbalances, thiamine deficiency, Wernicke's encephalopathy, Mallory, Weiss tears, and fetal growth restrictions. Bleeding and ectopic or molar pregnancies. Any bleeding in early pregnancy raises concern. Common causes include subchorionic hematoma, 3% of pregnancies, implantation bleeding, threatened miscarriage, ectopic pregnancy, or molar pregnancy. Ectopic pregnancies occur in 1% of pregnancies. High risk and potentially life-threatening, typically require surgery or medical management. Molar pregnancies involve abnormal placental growth and extremely high HCG levels, sometimes with a coexisting fetus. Require evacuation and monitoring due to cancer risk. Blighted ovum, a type of miscarriage, occurs when a gestational sac forms but no embryo develops. Diagnosed by ultrasound. Pre-existing conditions and early risks. Diabetes. Poor glycemic control during organogenesis increases risks of neural tube defects, congenital malformations, heart, kidneys, macrosomia, and perinatal complications. Tight glucose management before and during early pregnancy is critical. Diagnostic tools and when to call your provider. Ultrasound is a key diagnostic tool. Gestational sac visible by 5 weeks via transvaginal ultrasound. Embryo and heartbeat seen once embryo reaches 5 mm, around 5 to 7 weeks. Crown rump length (CRL) measurement between 7 to 13 weeks provides accurate dating. When to seek medical attention immediately. You experience heavy bleeding or clots, severe abdominal or shoulder pain, fainting, dizziness or dehydration. No heartbeat on ultrasound after expected period. High fever and persistent vomiting with inability to retain fluids. The first trimester is awe-inspiring and high stakes. It's when your baby's organs form and the mother's body adapts. While symptoms and worries are expected, most pregnancies progress safely with proper care and early detection of concerns. Today we're exploring the magical, mysterious, and mildly nauseating world of first trimester pregnancy experiences. Spoiler: it's not all glowing skin and baby bump selfies. Sometimes it's just crackers, crying and questioning your life choices. Let's hear from some different moms' experiences that I have heard. My friend would mention to me. So the minute I got that positive test, I started tracking everything. I made a pregnancy spreadsheet. Vitamins, bacon, water, 80 ounces a day, exercise, prenatal yoga and daily walks. Though you would not manage all of this, just take one day at a time and do what you can manage. One mother would say. So I didn't know I was pregnant for the first 6 weeks. I just thought I was tired and bloated. Like more than usual. And the cravings. I was dipping pickles in peanut butter like it was gourmet cuisine. The best favor a pregnant woman would wish is not to be judged. Morning sickness. Try all-day sickness. Some moms puke so often and others have it easy. Some mothers tried ginger, crackers, acupuncture, hypnosis, or just a simple massage. Do what suits you best. Back in the older days, mothers didn't have apps telling them what fruit the baby is. They just hoped the baby came out with all its toes and didn't look like Uncle Earl. But I will say that first trimester, it's a ride. You cry, you glow, you fart uncontrollably in line at the grocery store. And that's all before lunch. Whether you're a puking mess, a peaceful queen, or somewhere in between, one thing's for sure. The first trimester is wild. So if you're currently growing a human, cut yourself some slack. You're doing amazing. Stay in communication with your healthcare provider, trust in your body, and be kind to yourself. Navigating the second trimester with ease and knowledge. Take care and congratulations again. If you like this video, give it a thumbs up, share it with your pregnant bestie, and drop your weirdest first trimester craving in the comments below. Mine was yogurt on coconut cookies. Don't ask. Subscribe for more of this epic, unpredictable pregnancy chaos. Until next time, stay hydrated and take your prenatals.